Hi, everyone. This is group 15. This is our physician burnout presentation. My name is Chelsea Amaya.
My name is Sophia Blankenship.
And I'm Haneen Rama.
Okay. I will now be introducing the paper itself. With the recent rise of COVID-19, more healthcare providers have opted to leave the healthcare field. As there has been a sudden increase of turnover rates, many have questioned what causes healthcare providers to suddenly leave their line of work and how it can affect the healthcare industry as a whole. With a culture of overwork, a lack of support resources within an organization, and a lack of autonomy, drastic effects such as access to care, patient safety, and care quality all follow when healthcare professionals start to feel the symptoms of burnout. We believe that a change at the root of the company, such as management, is an excellent way to solve the increase of physician burnout. A change in leadership, the culture of the work environment, and beginning to ignore societal pressures of all work and no play can help shape the healthcare facility in a way where physicians' needs are being met and they are completing their daily tasks without worry. By addressing these problems, the health system can begin to see a change in how it helps healthcare personnel and make an effort to decrease physician burnout. We must shift our focus on changing the culture of the healthcare system, focusing more on the mental and physical well being of physicians.
This healthcare challenge is important because it takes a toll on the provider itself and patients, which is detrimental to patient care and can also interfere with someone's well-being. The problem has been pretty common through the years, and it is definitely more common for healthcare providers, and it has gotten worse with the current pandemic. Sometimes one would not notice the symptoms at first, but it can creep up eventually. A bad outcome that could happen because of not addressing the problem could be affecting healthcare delivery, which includes the patient's safety, the quality of care, and also patient satisfaction. If the signs are ignored, it can also lead to health consequences such as excessive stress, fatigue, insomnia, sadness, anger, and many more things. The people affected could be coworkers around them, their patients, and family or friends. Society could also be affected if there's a shortage of healthcare workers due to them being affected by burnout. It is important to learn strategies or tips to deal with burnout so that one can prevent it from the start or learn to recover from it. Burnout is a problem that is overlooked and needs to be addressed in order to combat it, and we can start as future leaders.
So the following are 3 challenges that contribute to the challenges of addressing provider burnout. The first one being a culture of overwork. Organizations are continuing to value economic gain over employee satisfaction. Many healthcare systems can easily mimic this present social construct of continuous work and no play that has been the standard of good job practices in varying fields. In the healthcare field, providers are being asked to take on more patients and daily tasks. This mentality of being able to do it all has hindered many workplace environments. Organizations enable this culture by requiring longer working hours or higher work productivity, and they are ignoring the fact that their providers could potentially be taking on too much stress and harming their mental and physical health. Without a support system in place, many employees have nowhere to turn when the first signs of burnout are manifesting. Organizations should be aware of the direct correlation between turnover rates and job satisfaction. Employees are more likely to report higher levels of satisfaction when supported and encouraged to achieve team goals and achieve meaningful work. A lack of autonomy in the workplace can stem from supervisors not valuing their employees and controlling how and when their work is done. This kind of controlling leadership demands too much from employers and causes them to be overwhelmed and be scared of making any mistakes. Ensuring healthcare workers in an organization have the right competencies is up to the organization, human resource managers, and leadership departments. HR managers are there to support and help employees experiencing burnout. One such way is by incorporating training programs that encourage employees to seek out resources that help prevent emotional exhaustion, strengthen resilience, and manage a work overload. An example of a training program that can be actively seen at Northwestern Memorial Hospital in Chicago, Illinois. This program, titled Scholars of Wellness, is a physician-led initiative to identify drivers of physician burnout and develop solutions to improve personal and professional well-being. The goal is to equip physicians with the knowledge and tools to drive meaningful change. Programs like the one at Northwestern have been introduced all over the country in an effort to support the work of physicians during the COVID-19 pandemic and prioritize the issues of provider burnout.
Proposed solutions. After reviewing studies, blogs, and articles regarding physician burnout and how other healthcare organizations are solving it, we proposed a few solutions to implement. We believe that solving the problem must be addressed at the root of the source. Management and administrative teams must begin to critically assess their workforce and see where the faults may lie. For example, lack of proper EHR equipment, poor work culture, or even overworking the physicians. By providing resources such as training programs or workshops, we can begin to see a decrease in burnout. Another important solution to mention is the idea behind physician mental health. By focusing on creating healthy, relationship-based work environment, physicians can feel more welcomed and safe to talk to their coworkers or executive board members. A team-based work environment can allow not only physicians, but all levels of the healthcare system to feel comfortable when at work. Okay, conclusion. Physician burnout is still drastically increasing. It can have physical and psychological consequences that can affect an individual. An increased culture of overwork, lack of support/resources within an organization, and a lack of autonomy has caused physician burnout to reach new heights. However, by addressing these problems and focusing on the culture of a health system and beginning to change it through leadership, the culture of the work environment, and ignoring societal pressures of all work and no play, the health system can begin to see a change in how it helps healthcare personnel and make an effort to decrease burnout rates. Without proper training and care for the provider's overall health, the healthcare system will continue to see the devastating effects of burnout. How can we expect physicians to care for us if they lack proper resources to care for themselves? And then we have our sources. First slide, second slide, third slide, and last slide. Thank you so much for listening to our presentation. Thank you. If you have any questions, please feel free to reach out.
Thank you.